The federal government is seeking to delay an expansion of its medical assistance in dying law to include those suffering from mental illness, as mental health experts continue to raise their concerns.
We have heard concerns of Canadians and experts about whether the healthcare system will be ready to accommodate MAID requests for persons whose sole medical condition is a mental illness. Today, we are letting Canadians know that our government intends to work with our parliamentary colleagues in the House and Senate to negotiate an extension of the March 17th, 2023 eligibility date.
The chairs of psychiatry departments, at Canada's 17 medical schools push for this delay. Valerie Taylor is the psychiatry chair at the University of Calgary and heads the Association of Chairs of Psychiatry in Canada. She joins us in Calgary. Dr. Taylor, good to talk to you again. When last we spoke, you were calling for this delay. So I wonder, we don't know how long of a delay it's going to be, but what needs to change between now and when the new implementation date is?
Well, we simply wanted some opportunities to provide some more feedback and to ensure that all of the policies and procedures are evidence-based and clear. This is going to be a provincial rollout across the country, and so we want to make sure that there's no ambiguity and that we don't get delays after the rollout because people are not sure how to proceed. And so we're really grateful that the concerns were heard and that there is a delay to give us some time to work on that and to work with Health Canada and the people that have done a lot of work up until now. It's not as if nothing has been done, but I think it's really important to fine-tune some of the nuances about this, and this gives us the chance to do that.
Now, even in announcing this delay yesterday, Minister Lametti did point out that the chair of the government's expert panel, that's Dr. Mona Gupta, told the government the safeguards are in place to meet the March 17th deadline for this expansion. So why do you want the delay when the head of their expert panel thinks they are ready to go?
I think there's a difference between feeling that the safeguards are in place and really understanding pragmatic on-the-ground implementation. And that's a voice that we're trying to speak from. Again, respectfully kind of acknowledging that there is a significant amount of work, but there still are some questions and some nuances that we need to get some clarity on. And so we look forward to working with Dr. Gupta and her group to ensure that when this does roll out, that it's going to be a smooth implementation.
Just on timing, do you think the extra time would be a question of weeks? Would it be a question of months? Or could it be something that even needs to go beyond this year or beyond 2023? Because there are people who have been advocating for this opportunity who are disappointed in this delay. So how, can you ballpark how much time you think is needed here?
I don't think it's up to me or my group to comment on exactly that. I know that we want to see it roll out as quickly as possible, as do other people involved in this process. And so, again, it's not up to me, but certainly we would like to see it happen in 2023 for sure.
Okay, so when we spoke earlier this month, you raised a lack of trained psychiatrists to handle a possible influx of cases. And the Minister for Mental Health and Addictions, Carolyn Bennett, said Canadians should expect instances to be very rare and follow long courses of treatment and assessment processes. I mean, what's your view on that expectation by the Minister?
I think we don't know what we're going to see, but we do know that there are some questions around whether or not we need to have a psychiatrist or mental health specialist as a mandatory assessor, whether or not that's going to be feasible, or if that request is going to cause delays, whether or not a psychiatrist as a consultant is sufficient, whether or not we can have consultants in one province consulting on cases in another if we have some lags. So it's just, there's some fine tuning needed, but it's not as if we're far from the finish line. We just want to make sure that this has been ongoing for 2 years. We don't want to see a rush due to some arbitrary deadline that will then actually delay implementation, because I think if we run into problems quite quickly, there are going to be pauses at the provincial level. And so, our goal is actually to ensure that this gets up and running in a way that patients and practitioners are comfortable with sooner rather than later. And so we are really grateful for the opportunity to work with the government, to work with Health Canada, and ensure that the final product is something that is evidence-based and going to be simpler. It's never going to be simple, but simpler to implement.
Right. You're not trying to stop it from getting done. You just want to make sure it's done right. I understand that position. But you have on the other side of it, you have advocates of the expansion who are arguing that barring one group from assisted death is discriminatory and unconstitutional and stigmatizing. So what's your message to people who, while you support this expansion of medical assisted in dying, people who oppose this extension, they want this to come into effect on the original date in March? What's your message to them?
But I think we want the same thing. We want this to be implemented in a way that's going to make this accessible and easy for people involved to understand. And so I think the best way to do that is to make sure we do it right the first time. And again, this is not a delay forever. It is just we want to make sure that there is not a start and stop. We want this, when it starts, to be able to move forward. And so I think we want the same thing, and I understand where they're coming from, and they've been waiting for a long time. And, I've received a lot of emails, a lot of conversation, very meaningful conversation. I think we want the same thing, and, and I think we're going to get there.
Okay, so now that you have a little bit more time, how will your association be reaching out to the government with advice and on what exactly needs to be done as they negotiate with the other political parties to get a legislated extension?
Well, we've already engaged at a provincial level many of the different heads of the departments of psychiatry across Canada with the local registrars who are going to be tasked with implementing this or helping to implement this on a provincial level. There is a feedback document, and not surprisingly, they're asking for rapid feedback, which is not unreasonable. We are engaged in providing that rapid feedback and setting up a series of meetings to engage with the Health Canada group so that we can share our questions, concerns, and help them come to solutions that everybody finds acceptable.
Okay, Dr. Valerie Taylor, thank you for your time. Oh, sorry, what was that last thing you said?
I said as fast as possible.
As fast as possible. All right. Well, Dr. Valerie Taylor, thank you for your time. It's good to talk to you again. Appreciate you making yourself available. It's Dr. Valerie Taylor in Calgary.